So you at least identify a viscera, you identify a bone, and one thing I tell you, the examiners don't ask you, he'll ask you to pick up one from the tray. But you just don't wait. You rattle, machine gun, you're seeing Netflix movies and all. So you just say, this is a human skull. Okay, this is a skull. And you hold it this. Hold it. Now, you just have to, you go and say, this is made of some paired bones and one single bone. You say this. Now, what are the paired bones? The single bone is the frontal bone, the occipital bone. Now, the occiput has a foramen magnum. These are the condyles that articulate through the vertebra. Okay. Now, this is it. Now, this is the temporal bone. Temporal, you have the mastoid process. Here, mastoid process, and this is the external auditory meatus. External auditory meatus. Okay. Now, you have the zygomatic process of the temporal bone, which articulates with the zygomatic process of the zygomatic bone. Now, this is paired, your two parietal bones are paired, frontal bone, occipital bone, unpaired. Okay. Now, similarly, you have the maxilla, one right maxilla, left maxilla, paired bones. Okay. Now, you have your kalke. Yesterday I got a shock, means I became sad. The liver was such a good specimen, but some surgeon has done a lobectomy. The left lobe is totally cut off. Anyway, today I am telling you, all in this, because again it will be repeated. You just see the bones, I am naming them, and identify what bone is this. I have given you all original bones. Please handle with care, and you identify amongst yourself. I'll just show you which bone is what. Okay, this is the skull. I told you the bones. Okay, you see, don't hold it like this. You hold it like this. Examination, be very practical. In MS master degree, in my time, 2 days practicals. No sleep. Half an hour or something, I slept and sat for the exam. Those days are finished. There are many unnecessary things. Unnecessary, it's necessary, but the small things are not to be this thing. You have to identify the main structures, main features. If you cannot show you the liver, I mean, it's like I'm taking a postmortem of yesterday's batch. Batch means not the whole batch, a small batch. And I'm telling you, don't panic. Yesterday what happened, I came late. That I must apologize anyway. Now, no one is coming. I sat down, no one is coming. I'm calling them, no one is coming. Anyway, I just said, come, hurry up. they sat, then slowly they don't. You just sit, call your फांसी का फंदा होगा. So you sit down calmly, identify anything that you don't panic. No. You see, if the examiner points out this skull, you just don't do this. Pick it up. Because it is not expected that you don't know the skull. This is one thing. Then you over here in the class test or whatever, you are given a choice, means, oh, आपने सर नहीं पढ़ा, no पढ़ा नहीं होगा. You have to say something. Say something. Just say it's a skull. It's a human skull. Now you have to, accordingly, you have to just identify the bones first. Second thing, don't think of the 46 muscles of the face. Don't think of it. Once the skull bone is given, you are thinking the face में क्या muscle है. Don't. Then you will get lost. Okay, you hold the skull. Now this is the frontal bone. This is the parietal bones too. This is the occipital bones. This is the temporal bone. This is the zygomatic process of the temporal bone. This is the external auditory meatus. Okay. Now you have the now the maxillas. Then the mandible. Okay. Now you see the inner surface. Don't get puzzled. Now the sphenoid. Now I'll start with one. Frontal bone. Frontal bone. এই তোমরা কি দেখছো কি? বই. You're making notes. What notes? Biochemistry. দেখো আমি একটা কথা বলি. You have plenty of time to feel. But those time in class 8 I didn't touch Sati. Anyway, I tell you, now why I'm telling you, feeling and touching and seeing is different from only rato. No, rato to karna hai. Mugging you have to. But if you are blank, point blank, at a uterus yesterday, your friends, blank, point blank. Your average, your age is what? Around 20, 22? 18 to 9, 20. Then you are aware of reproductive organs of the male and the female. If a girl doesn't identify what is the organ, so it was like that also. Okay. Now this is the frontal bone. Now this ও দাদা একটু দেখুন, ওগুলো দেখবেন পরে, ওটা পরে দেখবেন, বাড়িতে সময় আছে। তো আমি লাস্ট ওয়ার্ড কি বলেছি? বাস, অফ। নাও this is the frontal bone. What bone is this? Parietal. Now I'll show you. Now if I hold it like this, if you are not knowing, you will make a blunder. It is having a bowl. It is like a bowl. It is also like a bowl. This is frontal because you are having the orbit, external orbit, external orbit. This is the parietal. This has no such thing. But if you hold it anyway like this, it is a bowl. Both are bowl. You have to distinguish and differentiate the individual bones at least. Okay. Now, again I am telling you, see, I hold it like this. But the difference, sharp difference is the foramen backbone. কিন্তু তুমি যদি এইভাবে ধরি আমি এইভাবে ধরি এইভাবে ধরি foramen magnum is not there. But there are two orbits which comprises now this is the mandible, and never shout झगड़ा जब होगा ना किसी का भी साथ, don't yell hey shala, because temporomandibular joint is a joint that glides the condyle of the this is the mandible, this is the condyle, this is the choroid process. Now if you yell, the cartilages are there when Professor Vijit sir will have your lecture on your temporomandibular joint, TMJ. You might be having many books, atlases, anything. Please download from Gray just to see the picture of temporomandibular joint. It is so nice and so descriptive and so, it's outstanding. Every book has something to speak out. But I tell you that I have many volumes of Gray, but I tell you this illustration, it charmed me. Many things that you see I am presenting to you, you might not have seen. And also Chaurasia's pen drive I am using. But main thing is that the presentation in the ellipsoid cartilage and all that is so well explained and so well said. So you read from your Vistam Singh, Inderbir Singh, Shivani Majumdar, then Dr. Dotto, then your Samar Mitro. You can see Touch and Pass Anatomy book. There are some books, 40 days of anatomy. Like these books are there in the market. Now, what I want to say is that This is the mandible. The features, the sockets are there. That is the teeth. Okay. Now, this is the maxilla. Okay. It is having sockets. Now, this is the upper jaw. Upper jaw. Maxilla. This is the lower jaw. Mandible. Sockets for the teeth. Sockets for the teeth. দেখো ধরো তোমাদের কারোর বিয়ে ঠিক হলো, অ্যারেঞ্জ ম্যারেজ, so they send a photograph of the boy or send the photograph of the girl. থাকুক. Now, will you say yes after seeing the photo? Please raise your hand. Will you agree with your parents and the modern AI? The AI will make everything. Anyway, this is the sockets. This is the maxilla. This is the mandible. It has socket for the lower jaw. This is the socket for the upper jaw. Okay. Now, these are sphenoid. Sphenoid. It is having a greater wing and a lesser wing. See, it's like a bird. If you just imagine, it's like it's a, or it is like some your alien air helicopter or aeroplane. Now, there are externally also you will see some foramina. You have, I told you, on your vessels of the neck, head and neck. So these internal jugular vein and all this, whatever is going on. Now, if you see the base of the skull also has. Now, the petrous part of the temporal bone has a small opening. Small opening. This petrous part of the temporal bone. This is the squamous part. This is the zygomatic part. This is the mastoid part. The external auditory canal. Now, everything, some structures passes. And now the sphenoid, you see when you take the bone in your hand, you see you open up the structure passing to the superior orbital fissure. The structures, the eye and eyeball and all vessels, all this. Then now in the or this process, now it has a divides the brain both sides. Falx cerebri. It's a sickle shaped. It separates These things will be asked me. And you first of all see the skull 1, 2, 3, 4 dekh. You see individual bone. It is all pure means 100% human skeleton. We have the thing plastic or whatever it is. That's I don't know what material. So please see it. Go home, open an atlas, and see it, or your book. Best will be you have to be now studying from the book. Please come. You can see, but please don't break it. Don't break it. अरे घोड़ार मतो छोट Please return it before going. Don't tamper. Don't tamper. अरे ये अरे बुढ़ी बेड़े जावे एर वेट लॉस हो चे घर का खाना नहीं मिलता ऐसे hey, come in front. আমার বয়স জানিস 70 বছর বয়স আমার last week 9 operations I did, not small. So hysterectomy, gynae, 1, 2, 3, 5, 3 cesarean section, 2 hernias. Again tomorrow I'll have a big tomorrow. How?